U.S. spends 20% of GDP on healthcare, and we have one of the most expensive and least effective systems in the world. Numerous Obamacare co-ops have failed, and on a personal level, that translates to hundreds of cancer patients who are losing their coverage. 250 patients with the only insurer with Memorial Sloan Kettering Cancer Center in New York City are now affected. Actress and author of Tox-Sick, Suzanne Somers, is with me. She says we need serious healthcare reform. The candidates need to address the topic tomorrow night. Suzanne, thank you so much for the time and for sharing your insights as a cancer survivor. When you hear things like this, 250 people essentially losing access to great care, what does that make you feel about the healthcare system in the U.S.?
Well, the way I feel about the healthcare system in the U.S. in general is they act as though there's only one way to go, and that's allopathic. And what I write about in my books is another option, which would be alternative medicine. And I find, as I listen to debates and I listen to the candidates talking, they act as though there is no other way to go. I know with my own cancer, I think it was like 15 years ago, it's such a non-issue with me at this point because I did not go allopathic. I decided to change the way I eat. I decided to eliminate chemicals in my life and in what I put in my body and what I put on my body and what I clean my house with. So it's like a lot of the other topics in my books that I talk about where, you know, I've written so many books about hormones that they say, you know, the cancer connection with hormones. I'm going, well, you're only talking about synthetic hormones. If it costs now to die of cancer approximately $250,000, and if we are experiencing the greatest environmental assault in the history of humanity, and if they are putting together things such as glyphosate and GMO and engineered food with the cancer connection, calling them, you know, carcinogenic or possible carcinogens, then maybe we have to think about cleaning up the environment, and maybe we have to look at a different way of taking care of people, because it's, what is it, the Obamacare represents a third of our economy, or probably more at this point, and it's not working. And if you can't afford your deductible, what are you supposed to do?
What is the thing that you feel like, from a political standpoint, you would hope to hear tomorrow? Is there somebody that you feel like is at least willing to address, to your point, how sick some people feel, and it's not always cancer, but it's things that are considered maybe less life-threatening, but affect their lives nonetheless? I'm saying, you know, the brain fog, depression,
right,
other things that come from these poisons.
Well, what you're talking about, brain fog, you're talking about the new, I call them the initials, ADD, ADHD, OCD, bipolar, schizophrenia, dyslexia, dyspraxia, autism, asthma, et cetera, et cetera. And at present, according to the Environmental Working Group, close to 50% of our high school students are on prescribed amphetamines. That costs the country a lot of money, and to me it's a very non-creative way to treat, because there is evidence now that prolonged amphetamine use, 10, 15 years down the road, they're seeing solid tumors of the breast, lung, prostate, et cetera. So all these kids, what's that going to be down the road? So what I'm hoping, I'm not for a single issue candidate, but I'm looking at Dr. Carson. I would hope, because he's wise and because he's expansive in his thinking, that he would, like they do in Europe, and I'm not advocating the socialist medicine in Europe too, because that has its downfall. But the one thing I do admire in Europe is that if you go to your doctor in Europe, and particularly in France, which I know firsthand because I have family members, you can choose to have orthodox allopathic medicine, meaning here's my disease, here's the pill for it, or you can choose homeopathic or alternative, or all three.
There are choices with the patient.
And so here we have no choice. And I look at insurance companies and I think, if they wanted to talk to me, you know, go to info@SuzanneSomers.com, that maybe there's a way, because if we were proactive, maybe there's a way that insurance could actually cover alternative medicine.
And save money. That's a great idea.
Right.
We'll talk soon again, because I want to hear more. Suzanne Somers, in the meantime, author of Tox-Sick, joining me there. Thank you, Suzanne.